Capitol Report is a production of Senate Media Services.
This week, the Senate Tax Committee advances the omnibus tax bill. Two lawmakers promote differing approaches to paid family leave, and one lawmaker explains why changes in pharmacy services during the pandemic should become permanent. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. During the COVID-19 pandemic, the role of pharmacy care was extended to include the administration of vaccines and the ordering of some types of tests. As the authorization for those extra services expires, a bipartisan group of lawmakers would like to make them permanent. Joining me to explain is the Senate author of this package, Senator Zach Duckworth. Thanks for being here.
Good to be here. Thank you.
As the smoke is clearing from the pandemic, we are starting to reckon with the pros and cons of pandemic life. One of the pros, according to you, was the expanded role of pharmacists. Why should these offerings become permanent?
Great question, and you're right. We learned a lot of good things and a lot of not so good things as a result of the pandemic. And I think maybe drawing upon my military experience, one of the things that we often do after an operation or some sort of exercise is an after-action review. What went well? What could we have improved? And I think one of the things that we saw occur across the country that worked well, to include here in Minnesota, was the use of our local pharmacies and our pharmacists, so their expertise at those local locations throughout our communities. And so these bills, or one in particular, helps to continue to utilize those local experts in our communities to meet the medical needs of folks all across the state of Minnesota.
The authorization of these services came from what's called the PREP Act, the Public Readiness and Emergency Preparedness Act of 2020. What happens when that emergency authorization expires?
If and when that expires, we would see a lot of freedom and flexibility that's been afforded to some of our pharmacists across the country, kind of revert back to what law had been originally, which means less opportunities or less access for folks to get things like vaccines, immunizations, and other medical services and care that they're currently getting as a result of that act at their local pharmacies.
And so let's walk through the bills. There's three of them. The first one, Senate File 2678, would allow pharmacists to administer drugs through intramuscular and subcutaneous administration. So what does that mean?
Well, I should say I'm not a medical professional myself, but the long and short of it is it allows pharmacists, pharmacy interns, and those that are kind of under the supervision of a pharmacist, do things like help do placement of medical devices, administer immunizations, shots, administer tests that they might otherwise not be able to do under normal circumstances. So it really just affords them the freedom and flexibility to do more, to provide more care and help assist patients versus what they're able to do when that federal law isn't in place.
And based on what some of the people said at the press conference where you talked about this is important, especially in rural Minnesota or places where there is not ready access to a clinic. Is that right? Yeah,
so I live in Lakeville. It's in the South Metro, and you could look in either direction and find all kinds of healthcare providers and places where you can get treatment. That's not true of some places in greater Minnesota where the nearest hospital might be miles and miles away, but your local pharmacy might be much closer. And so if people can get some of the good critical care that they need, especially routine care done locally, why not afford them the ability to do that so they're getting it done regularly, which is good and better for their health, and also it's good for their local pharmacy as well.
The second bill, Senate File 3940, is perhaps a larger departure from the norm. It would allow a pharmacist to order and perform lab tests and administer vaccines. So in terms of lab tests, for example, if I'm pretty sure I have strep throat because I've had strep throat a number of times and I can usually tell, like, okay, I need to go get a strep test. Instead of going to my clinic, I could go to my pharmacist, they would do the test, confirm that I have it, and then write me a prescription?
In theory, that's what we could be moving to. So I've got 3 little kids, and as you can imagine, it's almost a weekly occurrence where one of them might have something, right? Whether it's strep, whether it's an ear infection, whether it's a temperature, you name it. And rather than always having to have folks necessarily go to the doctor's office for a checkup or strep test, something like that, maybe there are ways in which we can use our local pharmacies and our pharmacists to administer some of those tests or answer some of those questions. It'd be a lot more convenient for families as well as other people that are seeking medical care and treatment throughout the state. Really expedite things, make it more convenient, and meet the needs of people.
Now, and to the vaccine part of that, I did get my COVID booster at the pharmacy. That was the easiest, most convenient place to get it. But generally speaking, when I've gotten shots for any reason, boosters, I have gone to my clinic. It is certainly more convenient to go to a pharmacy, but in terms of managing one's health or the health of their children, if you're not going to the doctor, then you maybe, if you're not seeing a doctor regularly, then maybe you don't know that you're missing something like a tetanus. You wouldn't necessarily know that it's time for a tetanus booster. Or can you talk about the vaccine piece? Like, how could we keep track? How would people know without interacting with their doctor that it's time outside of like a flu shot or something?
Sure, and I think that's a very fair consideration. And I don't want to downplay the importance and the significance of our doctors and our physicians. Obviously, they play a critical role in the care of people all across Minnesota, especially our younger kids as they're growing and developing and getting those sorts of shots and immunizations along the way if they choose to. And so I think I guess I would answer your question by saying this. I would rather have the ability for somebody to get the shots, vaccines, or immunizations that they choose conveniently, rather than potentially not get them at all because it was maybe not as convenient. In terms of tracking, shot records, immunizations, whether that's in consultation or in coordination with their doctors, pharmacists, maybe that's something we need to continue to look at legislatively to see, hey, is there a way that we can maybe close some gaps or fill in some holes that result if we have people getting shots or immunizations here or there. I will tell you this, though, as a kid growing up, as families move, they don't necessarily always have the same doctor or physician that they're going to get their shots from or get their checkups from. And I know some work has been done behind the scenes to try to make it a little bit easier to streamline and share those records, of course, with people's permission, respecting their privacy. So if there are solutions that we can find that help us share that information in a way that patients are comfortable with, that respects their HIPAA privacy rights, then that might be a way that we can help solve that problem as well.
And just a moment on the third bill, Senate File 3823, it would ensure that pharmacists are reimbursed for the services that they provide at the same rate as providers. Why is this important?
So parity for local pharmacists is extremely important, and it gets back to one of the things you brought up earlier, which is in some areas of Minnesota, the local pharmacies are really the only place for people to get to in terms of treatment or care. And we're seeing them close their doors all across Minnesota at an alarming rate. So parity in terms of the compensation that our local pharmacies can get for the treatment and the services and the care that they're providing is absolutely crucial to helping us make sure that their doors stay open so they can take care of and treat the people in their communities.
Now, there's just one other question that I have, and it's about, are you at all concerned if people do end up going to a pharmacist for care as opposed to a doctor? A doctor will have a medical history, but a pharmacist wouldn't. And is there any concern about missing something?
I think there's always a concern about missing something, whether it's a doctor's office or the pharmacist's office. Hopefully the pharmacist is asking questions about medical history and people are sharing that information. I sometimes even have problems recalling my medical history when somebody's asking me those questions. So that's always a concern. But I would go back to my earlier statement, which is I would rather have somebody have the ability, the convenience, the ease of access to care than not have it at all. And hopefully, whether it's in front of a pharmacist, in front of a physician, a doctor, you name it, if they're getting in front of that healthcare, that medical professional and seeking medical attention, they'll get the advice and the care that they need.
You promoted these bills at a press conference with 2 DFL House members. So not only is it bipartisan, it is bicameral. How is it looking to get one or all 3 of these bills into law?
I remain hopeful, especially on at least 2 of them, that they're going to maybe find their way into becoming law this session. There's another, the one that has to do with pharmacy compensation for pharmacists and parity, that might need some additional work. But like you said, it's bipartisan, it's bicameral. People see the importance of this. People know and understand. We're hearing from our constituents how important meeting their health care needs are, and this is a way for both Republicans and Democrats to do this all across the state. So I'm very hopeful that we're going to continue to find success when it comes to this legislation.
Senator Zach Duckworth, thank you.
Thank you so much.
This week, the Senate Tax Committee advanced the omnibus tax bill, which would provide conformity to a number of federal provisions, reduce the state's first-tier income tax rate by nearly half, and eliminate all taxes on Social Security income.
For 2023, we've already spent, if you add up unemployment insurance, reinsurance, and now this tax bill, we've spent $4.5 billion. If you add in the tails through 25, we've spent $9.5 billion. So the money's all gone on what we've passed already through this Senate if we pass this tax bill. A lot of it is going to very affluent people.
Taking the lowest income tax and cutting that in half helps everyone. I mean, that's the whole goal of that. But we do have all kinds of problems. But eventually you have to say more money into each area is not the problem. If we're around the 5th or 6th highest tax state already, at what point do you say maybe it's not just about money?
The thrust of this bill to really again, reward those among us who are the most well-off is not a Minnesota value that I cherish.
You know, as we talk about fairness, at some point I think we need to talk about restoring money to those who have paid it. And just because they have been successful and make a good income doesn't mean that as government we should just automatically take it from them.
We are continuing to put Minnesota businesses at risk, and we are continuing to make it harder for Minnesotans to stay here, and we are continuing to make it harder for people to choose to come and raise their families in our great state. And the tax bill before us is a small step towards rectifying our often nation-leading tax burden.
Paid family and medical leave programs are popping up around the country. As of late January, Investopedia counted 9 states and the District of Columbia that either offer a plan or soon will. Senator Julia Coleman has a proposal to offer the benefit here in Minnesota, and she joins me to talk about it. Thanks for being here.
Thank you for having me on.
Paid family and medical leave plans have not traditionally been a priority of Republicans, and the colleagues who joined you when you announced this initiative were all younger Republicans with young families. Is there a sea change among the younger members of your party?
I think there definitely is a change happening. The members who joined me at the caucus, while they haven't given birth themselves, they have seen their spouses or their friends and their friends' spouses go through that. And we're seeing that one of the biggest things that we can do to help address issues like maternal health, maternal mental health, is to talk about these things, talk about paid family leave. And that's one of the things I love about my caucus is we have several young families, moms and dads, walking through life right now with growing families in Minnesota that are experiencing their priorities firsthand.
And it is hard to be parents of young children. There's a lot of expenses, there's illnesses and colds and all kinds of things that really create difficulties in scheduling and careers and work. But your proposal is a little bit different from what we have traditionally become accustomed to hearing about from the DFL, because it would change state law so that private insurance companies can offer products to businesses as a means to offering the benefit. Why approach it this way?
My philosophy is always, can we find a free market solution before we look to the government? And is there a way that government getting out of the way can perhaps solve this problem? And I think that's what we found here, is that by government allowing the authorization of this product that providers want, that businesses want, that employers want, we're solving this issue. We're expanding access to paid family leave in a way that's simple and efficient.
If the benefit is purchased by businesses on an individual basis, does that mean then that each business gets to sort of set the parameters as to what is being offered? So for example, one small business might offer 80% of wage replacement with up to 12 weeks, or another employer might offer 90%, or another employer might say, I'll split the cost with you. Would it be different according to the employer and what kind of plan they choose?
Exactly, and that's the biggest point, is it's customizable. It's not a one-size-fits-all approach. For example, if you are a firm that works a lot in construction and most of your employees are men, you can maybe tailor your benefit package to be more tailored towards Say if you have a sick child or a sick parent that you want to take care of versus maternal time off. If you have a company that has a lot of growing families, it may be wise to tailor it more towards that. Each business can decide how they want to tailor it, how much they want to cover, and what makes sense for them, their budget, and the budget of their employees.
And I imagine then this is a recruiting tool in this tight labor market that seems to be emerging to attract new employees?
Absolutely. That's the number one thing we're hearing from small businesses. Almost all of them have help wanted signs in the window right now, but they're struggling to compete with, say, big, large companies in this state that already offer amazing paid family leave benefits, but they can't afford that. And so our plan offers the ability for them to compete with these large companies by having these competitive benefit packages. And if they can't afford the insurance product, that's where our tax credits for small businesses come into play.
And that is my next question. There are tax credits. Will businesses then who offer this leave benefit to their employees get a tax benefit? And how does that actually work?
So it's specifically tailored with small businesses in mind. We don't want large companies that can already offer paid family leave to take advantage of it, and then there's no benefit there for the small companies. So if you have 50 or fewer employees and you're struggling to afford this competitive benefit package, then you will get up to $3,000 per employee you cover in a tax credit. That'll enable them to be players in this market, to offer these competitive benefit packages and really help these small mom and pop shops out.
So we're talking about paid family leave and not paid family and medical leave. So just to be clear, what is the difference between paid family leave and paid family and medical leave?
Well, we already have medical leave in the state of Minnesota. We have short-term disability and we have long-term disability. So those are covered, but where there's gaps in the system is the paid family leave portion. If you're taking care of a parent at the end of their lives, my in-laws experience taking care of children at the end of their lives. If you are welcoming a new child through adoption, foster care, birth, and you're the mom or the dad, those aren't covered yet in Minnesota, whereas medical leave is. So this expands access to those paid family leave options.
Now, when I had my children, I was an adjunct faculty member, I was self-employed, and I had another part-time job. I was very busy, and I was only able to take off 1 week for each child. Is there any way for people who are self-employed or part-time employees or work multiple jobs to be able to access this benefit?
There's a couple of avenues they can take, and first of all, I'm sorry that you only got 1 week off. I can't imagine how hard that would have been. There's an option, it's written broadly enough that people could be covered if they so chose to be in that aspect. There's also, it's written broadly enough where trades, business partnerships can offer it to their employees. And then there's another avenue that our caucus is looking at, and this is through Senator Carla Nelson's tax bill, that would offer a tax credit for the individual or the employer to cover the expenses that would be taken during time home to, for in that example, bond with a new baby.
The DFL has been proposing a plan for several years now that I mentioned earlier, and it's a state-managed program based on sort of the uninsured or unemployed insurance kind of system that is already within the state of Minnesota. In that case, all employers are required to pay. So with your model, it is a perhaps smaller model based on what individual businesses need. So there isn't necessarily the scale that there would be for the DFL plan. But what is your take on that? I mean, is there a scale issue here?
I don't think so. We're seeing immense success in states that are trying similar rollouts of the paid family leave insurance. So much so that they're, I believe in New Hampshire, removing the state as one of the insurance providers because the private market is doing so well. And the reason we're hearing from insurance companies that they want to come into states like Minnesota is because it is faring so well. What we hear from small businesses, what we hear from employers is help me to access these benefits. We don't hear, give me threats of fines, give me another tax, give me another mandate. And so I think this addresses what they're asking for without all of that.
Senator Julia Coleman, thank you so much.
Thank you.
Senator Susan Kent has been advocating for a paid family and medical leave program in Minnesota for several years now. I spoke with her recently, and I began by asking why Minnesotans need this benefit.
I think you can ask any Minnesotan that question and they'll give you a good answer, and there are a lot of them. If they have a baby and they need time off from work, we know that about 25% to 33% of mothers who give birth have to go back to work within 2 weeks of giving birth. Nobody chooses to go back to work 2 weeks of giving birth, and this is the only way we're really going to get at that. If you have a serious illness, and you need serious cancer treatments, say for example, that sideline you, or you have a serious injury, or you have an ailing elderly parent and you need to be there for them and to care for them. Any of these are just some examples of why Minnesotans need this benefit.
As I mentioned in the introduction, there's a growing list of states that are adopting some kind of paid family leave benefit, and each state operates differently. What, in general, are the startup costs likely to be? How long until it's fully functional? If it would become law, how long until we achieve, sort of a regular benefit that people could take advantage of?
If we were there, and there have been several different proposals, and my bill has not had a hearing, so we've not been able to really debate and discuss and amend to address some of these questions. But because that's the purpose of giving bills hearings, so that we can do that public process. But one of the proposals is that people would pay into the fund for 2 years and then it would be fully operational. There are other options. For example, it's been proposed we could use some of this surplus money, one-time surplus money, to just get it started, and it would take some time to get it literally implemented and up and running. But pretty quickly, maybe a year, we could have people taking advantage of this.
In essence, the state would be creating an insurance plan that all employees would pay into, and that then anyone could dip into for a qualifying event. As you said, the birth of a child or the adoption of a child or caring for a seriously ill loved one, and still get paid. What level of wage replacement are we talking about?
It depends. It's on a sliding scale, so that it's up to 90% if you are at the low end of the pay scale, so you get almost all of your payroll, your income taken care of, covered by this benefit. And if you make more money, it's down to, I think, 45 or 55%, and then it caps. So even if you make a lot of money, if you have a really big salary, you're not going to get 45 or 50% of it. It's designed to support those who really need it the most, who cannot afford to take that time off, either for themselves in a major illness or injury, or for a loved one. And we know that people need to not be put in the position of having to choose that kind of care, or paying the rent, putting food on the table.
Now, you mentioned that people who go back to work right after giving birth, and so I always wonder about people who are part-time, because when I had my children, I was an adjunct faculty member, and so I was not a full-time employee. I didn't have those kinds of benefits. I ended up taking a week for each child. Would part-time workers be eligible for maybe a prorated amount?
Yes, and it is structured to work so that part-time workers have the opportunity as well. And as I had my baby when I was self-employed, and self-employed people can opt into it. And same thing, they can pay into it, and then they can potentially pay somebody to keep doing the work while they're taking the time off.
Some of the larger businesses in Minnesota are already self-funding this benefit for their own employees. And with a tight labor market, that is certainly an attraction for employees, and creating maybe an unlevel playing field then. For those companies that already have this, would your bill preempt their plans?
What the bill does is it says that if you, as an employer, any size, are offering a benefit that meets the standards, the same standards that the state plan would be, you can keep yours. Or if yours is a little short, you can just upgrade yours and meet those same standards. But it does say that every Minnesotan would qualify in their workplace to have access to this benefit and have the option of leave when they need it for as long as they need it, up to 12 weeks, so that they don't have to make that difficult choice.
As you know, Republican Senator Julia Coleman has proposed a measure that would allow businesses, especially small ones who can't compete with these larger companies, to purchase insurance products on behalf of their employees as a way to expand that benefit to more Minnesotans. Could you support this, knowing that it is at least moving the needle forward for more Minnesotans?
First of all, I'm really glad to see that there is bipartisan efforts to try to solve this very real need for Minnesotans. My concerns with these proposals is the way they are. First of all, when you the proposals don't cover everybody. They, both in terms of they don't have the medical leave part of this. This is only a family leave plan. If you have pregnancy complications, it doesn't count. Then it's more expensive because anytime you go through the private insurance industry, it just is a more expensive because you've got a smaller pool. The larger pool of a statewide plan is what brings the cost down for everybody across the board, and then which makes it feasible to make everybody able to receive the benefit. And then the other problem with this one is that it is capped. There's just, you know, if the state were to subsidize this for everybody through this type of a mechanism, we couldn't afford to do it. So it'll be relatively few people who have access to it. The math just doesn't work to make it widely available, and it doesn't prohibit a company like, for example, a major corporation. As we've seen, they will sometimes provide benefits to people in headquarters, corporate headquarters, but not for folks who are working, say, in the restaurant outlets or in the retail outlets. That would still allow those kinds of picking and choosing to happen.
Now, the one criticism, though, that I have heard from some Republicans is that this proposal is sort of a one-size-fits-all approach and potentially creates another MNLARS because it would be a state-run program. How do you counter that?
One of the things I would say is the way that ours is developed. First of all, we have been learning from states that have been doing it. The state of Washington, for example, has a very similar unemployment insurance system that Minnesota has. And so we can model our paid family medical leave program off our unemployment insurance system and also off the program that Washington State has very successfully implemented. So we don't have to have whole new computer systems. We don't have to reinvent the wheel. It takes advantage of all the great learning of what we know works and what we know worked through the pandemic. Let's be clear, these states got to kick the tires on their plans and their policies through a historic time, and it worked. And so, you know, we feel like that's a pretty good testimonial for what that could do for Minnesotans.
Now, one more thing before we go, because you were elected to the Senate in 2012, and you served as leader of the DFL caucus from early 2020 until last September, when you announced that you were going to retire and you stepped down from your leadership role. What over this decade are you most proud of?
That is such a hard question because there's so much. I'm really proud of what we've been able to do really with DFL leadership, both in the governor's office and in the legislature at different points in terms of bringing our budget back from a crisis, not having the ongoing surplus deficits, which means we're constantly having to cut for schools and our public safety and judiciary and communities. I would also point to, I will never forget voting for same-sex marriage and what that meant for so many people. And the last one I will say is being able to support student mental health and counselors, school psychologists, and social workers. We made a dent in that, but as we know right now, more than ever, we need to keep doing that.
Senator Susan Kent, thank you so much.
Thank you.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.